Hey pizza lovers, are you ready for an amazing opportunity that combines your love for pizza with the chance to win big? Click the link in the video description now and take our survey for your chance to enjoy free pizza for a year and a complimentary Visa gift card.
Elite athletes may be in top physical shape, able to sprint, lift and play at the highest level of their sport, but a shock study shows they are at higher risk of deadly cardiovascular complications. There have been a string of high-profile heart scares among top athletes like LeBron James basketball star son Bronny James at 18 years old and Hall of Famer Boston Celtics player Reggie Lewis. Both suffered cardiac arrest while playing their sport, with the latter dying because of it at just 27 years old. And just this week, Kansas City Chiefs player B.J. Thompson experienced cardiac arrest after having a seizure. The team reports he was in stable condition following hospitalization. Events like this come as a shock as people wonder how premier athletes suffer a medical event associated with poor diet, obesity, and a multitude of other poor comorbidities. And in the wake of the COVID-19 pandemic, some believed vaccines may have played a role, while others say the virus itself may be to blame. But now, scientists believe they've discovered a potential explanation behind why people in the best shape of their lives are suffering from cardiac conditions, hypertension, or high blood pressure. Presenting findings at the American College of Cardiology's Care of the Athletic Heart Conference, a researcher from the University of Los Angeles Medical Center found nearly half of athletes suffered from elevated blood pressure, with multi-sport athletes and basketball players most at risk. Among the general population in the U.S., approximately 47% of people have high blood pressure, but athletes much younger than the average hypertension patient are still suffering from the condition. Author of the abstract Dr. Anik Malik, medical director of the Saving Hearts Foundation, said, despite being perceived as a generally healthy population, young athletes are not immune to heart disease, including elevated blood pressure. Researchers looked at 1,200 young athletes involved in a community-based athlete screening program in the Los Angeles area between the ages of 10 and 31 years old. A majority of participants were men, 60%, and women comprised 40%. Results showed 21% of athletes were classified as having prehypertension, 13% had stage 1 hypertension, and 8% were diagnosed with stage 2 hypertension. The researchers attributed hypertension in athletes to training they undergo, such as certain cardio drills to improve endurance and speed or heavy weight lifting to build up key muscles used in games. A difference in diets to maintain peak performance may also play a role, with different calorie, fat, and protein ratios consumed by different players. Additionally, the difference in physical size of athletes, such as extreme height in basketball players or heavier weight for certain football players, may also contribute. In the case of hypertension, size matters because blood has farther to travel in people who are physically larger, increasing how hard the heart works. Blood pressure is measured in two numbers in millimeters of mercury, mmHg. The first number represents the pressure caused by the heart beating and pushing blood through arteries, and the second is pressure in arteries as the heart relaxes between beats. A healthy blood pressure for most adults is 90 to 120 over 60 to 80 millimeters of mercury. Prehypertension is 120 to 129 / less than 80. Stage 1 is 130 to 139 over 80 to 89 millimeters of mercury, and stage 2 is more than 140 / more than 90. When someone has blood pressure higher than 120 over 80 mmHg, their heart is in overdrive, according to the American College of Cardiology. This forces the organ to work harder to pump blood throughout the body. Over time, high blood pressure can weaken the heart and blood vessels, which can cause cardiovascular disease, including sudden cardiac arrest. Male athletes in the study were more likely than female ones to have stage 1 or 2 hypertension, and athletes who participated in multiple sports had the highest prevalence, at about 1/4. Basketball players and football players were nearly tied for second highest occurrence at about 1 in 4. Based on the findings, Dr. Malik said, the study highlights the importance of recognizing and addressing elevated blood pressure in young athletes. The findings emphasize that screening for hypertension should be a routine part of sports physicals.